Good afternoon, everybody, and thank you and welcome to the first panel. I want to start with a quote from John Maynard Keynes in 1937. He said, "The idea of the future being different from the present is so repugnant to our conventional modes of thought and behavior that we, most of us, offer a great resistance to acting on it in practice." And I'm pleased to say we found four leaders who have overcome that resistance. And today and this afternoon will share with you their wisdom and thoughts and ideas on some of the practices that are going to be required to think about the future and change the future as well. On my right-hand side, I have the great honor of presenting Dr. Agnes, who many of you will know as an inspirational Minister of Health from Rwanda. She's been at the vanguard of fighting against HIV/AIDS and improving maternal and child survival in her country, and with a particular focus on evidence-based priorities and policies. Prior to this, she was the Permanent Secretary of the Ministry of Health, and she's currently a Senior Lecturer in the Department of Global Health and Social Medicine at the Harvard Medical School, and a member of editorial boards of the Public Library of Science, Medicine, and the Journal of Health and Human Rights. Welcome. Next to her is Professor Dame Sally Davies, who is the Chief Medical Officer for England and also advises the UK government. She has also managed to keep hold, quite smartly, of the R&D budget for the UK and is the Chief Scientific Advisor for the Department of Health. Next to her is Professor Julio Frank, who many of you will be very familiar with. He's the Dean of the Faculty of the Harvard School of Public Health and the T.N.G. Angopoulos Professor of Public Health and International Development, a joint appointment with the Harvard Kennedy School of Government. Prior to his role at Harvard, he was served as the Minister of Health of Mexico from 2000 to 2006. And finally, but not least, is President Ricardo Lagos, who is a lawyer, economist, and a social democratic politician who served as President of Chile from 2000 to 2006. Since May 2007, he has served as a Special Envoy on Climate Change for the United Nations Secretary General. He also teaches political and economic development at the Brown University in the US. He's also the former president of the Club of Madrid. So thank you. As you know, our role this afternoon is really to set the scene for the election, which is going to happen after this panel, in terms of the two or three leading trends that this group will then concentrate on in the afternoon. So I really do want to start with your candidates and put forward the argument for the two or three trends, either within the 10 that are on the list or ones that you've thought need to come out of the list or are not on the list. But just to put your case forward for which two or three you would urge the voters to vote for this afternoon. So, Mr. President, maybe I'll start with you. What for you are the two or three leading... Well, actually, I'll start with Dean. Prof, what for you are the two or three leading trends that you've seen from the literature and reading? And I know you've been involved in actually putting these trends forward as well.
Thank you. Thank you, Mickey. Let me, just before I answer, start by congratulating the Rockefeller Foundation on their centennial and thanking them, and especially Judith Rodin for the invitation. It turns out that the school that I am now proudly the dean of is also celebrating its centennial. So for me, it's a joyous occasion because we have the opportunity also. We were founded in 1913 and then as the Harvard MIT School for Health Officers. And then in 1922, thanks to a grant from the Rockefeller Foundation in the wake of the famous Walsh-Rose report, we became the Harvard School of Public Health. So it's a great occasion to be here. Obviously, the 10 trends that we have before us are all important. But I want to select actually one, and maybe I'll comment on others, but right now in my opening remarks, just focus on one, because I think this is the one trend where the revolution is starting right now. In many of the others, these have been ongoing processes of change. And but this one, it's starting right now, as we speak. And this is the last in our list, what is called new ways of learning. Education was conspicuous as one of the very few areas that did not experience a technological revolution during the 20th century. If you compare it with medicine or with transportation or with almost any other field of activity that underwent major technological revolutions in the 20th century, education stands out as one that did not. And I think we are at the threshold of a major transformation of the ways in which we impart knowledge and the way in which we acquire knowledge and we act upon knowledge. And that comes from the convergence of major insights in cognitive psychology on the other hand, and on the other, the development of new technological tools, especially the appearance of online tools that have led to this horrible acronym called MOOCs, Massive Open Online Courses. Courses that develop a huge platform for creating a virtual global classroom or learning space. We recently at the Harvard School of Public Health had the opportunity to develop our first MOOC, our first massive open online course. A course called Health in Numbers on the basics of epidemiology and biostatistics. Not the sexiest topic on the world, the rigorous, hardcore, quantitative elements of public health. 3-month duration, 55,000 people enrolled in the course. The numbers are just in. About 8,000 presented a final exam to try to validate their acquisition of knowledge, and 5,000 people actually passed the exam. That's about the number of folks we would have educated through our regular master's programs in 10 years. I think the potential for expanding access to knowledge that MOOCs or massive open online courses offer is enormous. It is also an incredible opportunity to modify and transform and enrich the educational experience of residential students through what Salman Khan has called the flipped classroom. The idea that what you do in the classroom is not simply to sit and receive instruction, but actually you do that much better while you carry on online education, so-called self-paced learning through self-assessment tools that allow you to learn at your own pace. And then you use the classroom experience for case-based learning, team problem solving, field immersion experiences, simulation, different tools for interactive participatory learning. Since knowledge was the driver of the health revolution of the 20th century, and I hope we'll talk more about that, I believe that the appearance of new platforms for modifying or transforming the access, the global access to knowledge, and the way we educate the next generation of leaders is absolutely one of the emerging trends. And it's a future that we are building today. It's not a future where we see a trend coming and we're trying to project as in some of the others. It is a trend that is being born today as we speak, and that therefore we have the opportunity to shape together.
Thanks, Prof. Very persuasive. Mr. President, what are your candidates?
Well, first of all, I would like to thank you for this invitation to share with you a few thoughts. In order to organize a little bit, I would like to present 7 ballots, very straightforward. Number 1, I think that what we are going to have is that we are going to be moving from market-oriented consumer society to citizens-oriented societies. This means that when you have a market consumer society, consumers define with the purchasing power what kind of societies are you going to have. Nevertheless, when you're talking about a citizen society, as citizens, all of us are equal. As a consumers, our size of our pocket is different. So what this means? This means that at the end, as Bobbio used to say, everybody has to be equal, at least in something. And when everybody is equal, at least in something, this is the minimum civilizatorio. What about health? And what kind of health is also going to be defined by citizens, not only by the market. Market is very useful to allocate resources, but not to shape a society. Number 2, I think that we are going to be moving from a rather uneven society to society with more social inclusion, social cohesion, or I used to be saying here in China, an harmonious society. Number three, if this is the case then, with regard to megacities, we are going to be moving toward cleaner cities. But that means that from the point of view of what are the major tasks, we are going to be moving from those societies that we are able to leave poverty behind, and you don't want to go back there, to societies where it's possible to build some sort of universal health care. And that is going to be the major area of division. Number four, I would say that we are going to be moving, given the new technologies, not to say internet, Facebook, Twitter, given the new technologies, you are going to be moving from a democracy that is representative. You elect who is going to represent you, to societies that will demand much more participation. And therefore, what are going to be the new institutions that are going to make possible that kind of bigger participation? I would like to elaborate later on this issue. Number five, I think that we are going to be moving from societies where, what is your per capita income? This was the way to be presented yourself. What country are you coming from? And we are going to be moving, because of climate change and carbon emissions, to a society where your yardstick is going to be, what is your per capita income? Oh, how interesting, congratulations. But let me something. What is your per capita emission? This is going to be the presentation card in the 21st century. What kind of emissions per capita you have? And this will be the showcase of how much civilized you are or you are not. And I think that the other point that is going to be extremely important is with regard to demography. I think that we are going to be moving from societies where we are fighting malnutrition to societies that now we are fighting obesity. Yes, as long as you are improving, malnutrition is not an issue anymore. It's obesity. And this means also that we're going to be moving from very young societies from the point of view of what are the measure of your population to older societies. And then, when you're moving from one to another, needless to say, the issue is what kind of health problem are you going to have with older societies? And what is going to be the meaning for that? Not to mention what are you going to be with all those people that are now retired, and for them retirement means not to wait for die, but another kind of life that you can accomplish. And finally, I would say, in number 7 ballot, is the question of the budget crunch. And I would say that you are going to be moving from learning some sound macroeconomic policies to some sound contracyclical policies. Because that means that if you are able to have contracyclical policies, then means finally that you are not going to produce adjustment, reducing social public policies, but reducing without any other areas because you are able with contracyclicals not to reduce your budget. And therefore, I think that because we have learned so many, now we know that we can be able to save during the sunny days in order to have something for the rainy days are coming. In other words, since we all of us know that we have cycles in our economy, then the question is not to have a budget that has to be balanced. Of course it has to be balanced, but it has to be balanced in the long term and not in the short one. And that means that it's in the long term, if the way that you're going to have a balanced budget That means then that when you have sunny days, a lot of income, fiscal income coming, then you save for the rainy days. And we have learned to have countercyclical policies. In short, I think that these 7 elements are going to be determinant in the kind of what is going to be the political framework where we are going to be able to put our health issue. Needless to say, the health issue and universal coverage and things like that is really a dream in many of our societies. The question is that in a democratic system, if dreams are not going to be fulfilled, then dreams can be a nightmare. And the question is, till what extent we are able to keep our dreams alive, because we are able to have different kind of instruments to shape our own societies. Thank you.
Thank you. I'm going to come back to you to try and get you to narrow your vote a little bit, but that was great. Thank you. Dr. Agnes, tell me what you...
Thank you. First of all, I would like also to congratulate Rockefeller Foundation, because this is a great and an important conference. And we, as so many people, wise people, has identified 10, and I narrowed them to 3. But as a policymaker and a program manager, I want to say that the 10 are important. And why I identified the 3 is because those 3 can lead to the 10. And I'm going to explain to you why. If you have your paper, you'll see number 8, 9, and 10. These are my choice. Technology race ahead. Why? Because those new technology will bring to a country like mine, where we have too few health professionals and capacity of education, the capacity to do good diagnostic, good treatment with the nanotechnology, and also good prevention with the new technology like HPV vaccine, prevention of cervical cancer. And the number 9, the game-changing advance in science, will help us by redirect the way we do research. It's a lot of money research, but many of those research we are doing now, the results are sleeping in a cupboard, just make some people very important and known, but do nothing to the people. So can we recentrate the research for the welfare of each and every individual on this planet? And so research for better policies, better implementation, better monitoring and evaluation, and also better real prevention, treatment, and diagnosis. And the number 10, I joined Dean Rulio, new ways of learning, because we have many people that can learn by giving services. If in a country like mine, when we have too few doctors already, I take 100 of them to make them specialists. During the time they are going in the north to be educated, 4 years, sometimes 6 years, how many people die because we have missed one MD? So e-learning, e-mentorship is very important and will allow us to increase. We cannot do that in all specialties, but we can do that in the majority, in many of them. Like in public health, we partner with Manchester University for training our head of district hospital in services. They are still serving, still saving life, and still they are upgraded in their day-to-day work and their capacity to serve. Nursing is the same. We have A2 nurses. We do e-learning so that during the time, the 3 years of they are going to get new knowledge, 70% of their time they can still serve, 30% of the time face-to-face in a school. So the new way of learning is important, and how it brings to the others. Take number 1, climate change and disaster. continent like mine, we are not ready to face it. We contribute very few, and the damage is very big to us. But we are not ready, we are not prepared to it. By better education, we can be prepared without leaving our position. So a new product for mitigation, like the new cook stove, you know, that save carbon and provide carbon credit. Those are new technology, providing new knowledge at communities and improve the life of women. They are cooking, they get, with the smoke, they got heart disease, pulmonary disease, and the child they have in the back got the same, an handicap for life. The number 2, demographic and revolution. We all know that better educated people cope better, voluntary with family planning, and in Rwanda it has paid fruit. We have an uptake of family planning by more than 450% in 10 years. This is due to the way the population has been educated, because it's voluntary. But also, in 10 years, less than 10 years, we have almost doubled our life expectancy. So we have shifted epidemiology. We start to have cancer has a high prevalence because we have we have controlled infectious disease, reducing 70% of, more than 70% of morbidity and mortality due to malaria, HIV, and tuberculosis. So cancer increased as a public health threat. When we faced that, we had only 2 oncologists in the country. For number 3, the mega cities, these go with pollution, education, innovation, new car, etc. For number 4, social and economic development, you know, the biggest disease of Africa is poverty. And it's a continent that is rich, what we have in our soil. This is discrepancy that will help us to have more money to build our health sector. So, and also we have to go for innovation way to grow economically. For example, we have all our community health workers. We have put them in cooperative. When they give service to the population as they are volunteer, we do performance-based. We pay them, put in money in cooperative that will generate economic growth at community level, 30% pay their services, the rest grow economic at pop. So we generate money and economic and welfare by providing health. So there are many innovations that we can do like that. I'm almost finished because frontier of public sector, reform, all this have to go with reform. And we have to promote public-private partnership, and we have to go even further, public-private community partnership. The say is going to be the most important part for a continent like Africa. The social inclusion, this also goes with research. You know, like we have universal access to health insurance almost in Rwanda. You know what we discovered last year? 10% are covered financially but don't have the card because they cannot afford the photo to go to the card. So they are covered, but they don't benefit. So there are many research that can provide more health than the traditional research we do. And also, we have to go in our culture because we are all different. We have all different cultural memories. We have to go back in our culture and recreate what was the social cohesion before. And we do that through Umuganda, where we come together once a month to do something for the more poor, that are identified with a system that is Ubudehe, a traditional one of solidarity. And there is many things we can do like that for future social cohesion going back in our history. And increased communication like internet, etc., but be careful. You know that Facebook is a driver of depression because we all go there and put, I just landed in Beijing and I just give the very good part of my life. And some depressed people who can read me say, I'm the only one sad in the world, because everybody is going to. So that means we have to think by some research on how to do to create a better social cohesion. The budget is important because it's the bottleneck, but as I say, for community health worker cooperative, we need to go in an innovative way to create riches. And also, we need to educate the population so that they can contribute to their own welfare in a better way. There is so much potential that is linked to education, new technology, a new type of research to find it. Thank you.
Thank you. Very inspiring. Sally, I can see from your choice of shoes that you've come to make some trouble today. So
now that would be unusual. Let me first congratulate the Rockefeller on its centenary, a wonderful day. And also to thank you for the time and space to dream. And I wanted first to imagine a world where we didn't have the engineering works that started in the 19th century, and we didn't have the physicists who came together from many countries at CERN, let alone the bioscience people who developed vaccines, and our health would be dreadful. So I want you all to put a vote for, or at least to pick up on where Dr. Liu left off, for science, because science can be game-changing, and it needn't be science that started off thinking it was game-changing for health. We know the internet has game-changed. We know that engineering and plumbing and sewage works game-changed health, and there are plenty more. Look at texting on mobile phones. So let me dream what we might see in 100 years. We might see children at the start of their lives having their whole genomic sequence taken, and then a little chip under the skin. So they have it, they control it, no issue of storage, but it's there. Whenever they're trying a new drug, they can look at the interactions. When they get to certain ages, they can see whether they have the risk genes or the disease genes. In 100 years, surely we will understand how the brain works. It's very difficult at the moment. It's one bit of the body you can't biopsy terribly easily. And once we know how the brain works, we can crack dementia. So the scaredness of aging, or at least one of them, will not be there. We will be able to treat dementia, Parkinson's. Meanwhile, we can then dream about not having mental ill health, and we can dream of a society where we can help people to be mentally well and have well-being. And I want us in our dreams to think about not only physical health, but also mental well-being as we go forward. We'll be able to turn off mental illness, and we'll be using another science, social sciences, to understand behavior and to move into prevention in new ways. So I'm dreaming of a better world. I do have a nightmare which leads into the second area I hope you'll give a vote for, and it is of solidarity. You dreamt of greater social cohesion in 100 years. I dream of that, but I have a nightmare that our society's solidarity is crumbling. I see it crumbling in the rise of the middle classes. I see it crumbling in our country with people not wanting to pay welfare and support people who are less well off, less well. I see it in the disapproval of people who don't look after themselves. I see it in Catalonia and Scotland wanting to be independent because they think then they'll spend their riches on their people rather than supporting other people who are less well off. And only if we can build that societal cohesion will we satisfy the dreams I have for 50 and 100 years out. And that cohesion will be particularly important in mega cities. So I think the discussion about the mega cities is going to be important, because in our big cities, as they get bigger, you need not only the engineering works to ensure the sewage, to ensure the clean air, to ensure the transport. We need the science around urban planning, the need for green spaces, the need for exercise, and we need to think how we will support and bring into equity those people on the edge of society, the people on the edge of those great cities who are in poverty, where the social inequality gives them health inequalities, and they do not have the rights that I believe they deserve. And we will have to face, as we go forward, whether the aging society becomes part of my perpetual nightmare, or we begin again to respect our elders, to support them in dignity, and develop that social cohesion better rather than lose it. So I'm dreaming of mega cities, because I know that's a trend that's coming, which have a society where our elders are truly integrated. We've found dignity back in health and healthcare. So just because we have a technology doesn't mean we have to use it, and that we go forward in much more cohesion across the globe. Please vote for science and megacities. Thank you.
Thank you. I do want to take up some of those themes that you set this on, and perhaps go to the Dean first. In terms of megacities and cohesion and governance, I mean, the latest, some of the latest projections are the 50 megacities of the world in the next 20 years will become larger economies than most middle and low-income countries. So there will be a huge amount of concentration of power and resources and so forth. So the challenge of equity and governance in that context will become quite central, and the governance gap, if you like, between the expectations of people who you've educated through your mega courses and the reality of the delivery that the cities can deliver may become wider and wider. I know you've been writing and thinking about this issue of governance, particularly at the global level. Do you want to reflect on those things?
Well, let me just take off where Sally just left us with the notion of solidarity, and extend it from the national level to the global level. I mean, there's no question that one of the underlying trends to all of the ones that are listed here is the continuing and deepening interdependence. And the question we have to ask ourselves is how do we mobilize ourselves in an interdependent globe to generate the global public goods that are necessary and manage the externalities that some sovereign countries impose on others. I mean, Agnes was talking about Africa getting all the bad stuff from climate change and not having the means to develop the resilience and the preparedness for the consequences. How do we do that? We do face a sovereignty paradox, because we have a world that's constituted by sovereign nation states. And the paradox comes because increasingly the determinants of the health of people, which is a responsibility in our world of national governments, the determinants of that health and the means to deal with or fulfill that responsibility are beyond the control of any one country, even the most powerful country. So how do we create governance? And if we're not going to have global government, I don't think. I mean, I wish we would, but I don't see that in the next 100 years. If anything, the number of nation states has multiplied in the last 50 years. What we need to think about is global society. A global society based on the notion of solidarity. And I don't use this term in an ideological sense. It's, by the way, a term that's been appropriated by everybody in the ideological spectrum. I use it in the original sense of Durkheim as the way of dealing with interdependence. And he coined the term in the notion, linked to the notion of the division of labor in an interdependent society. If we think of a global society, then we need to ask ourselves, is the health of the inhabitant of country X the responsibility also of the inhabitant of country Y? Do we have a common shared set of rights? And I think we basically agree in a framework of human rights that there are universal rights. And is there a shared responsibility? And if so, how do we develop the governance instruments at the global level to deal with those fundamental issues of common responsibility. This is not aid, this is not development assistance, it's not even cooperation. Because aid is a framework of dependence. Donors and recipients, it's an asymmetrical world. Cooperation is a notion of independence, right? Independent people cooperating. Solidarity is a notion of interdependence. How do we become and have common rights and common responsibilities? What are then the governance issues? On number 6, we address governance issues, but mostly at the national level. And I'm asking, what are the governance solutions, both to deal with this common set of responsibilities, but also to deal with the question of producing global public goods? Agnes, you voted for technology and science. You voted for science. I also vote for science. Because science, scientific knowledge, scientifically derived knowledge, is the ultimate global public good. How do we assure that enough of it is produced and enough of it is disseminated and then translated into action so that everyone can benefit from that? How do we manage the externalities that some countries impose on others when we have a world formed by sovereign nation states? To me, this is one of the crucial questions as we manage interdependence into the next 100 years.
One of the, and I'll put this to Mr. President, one of the challenges of having this vision, which you articulated as well, of solidarity as opposed to individuality and consumerist, as you called it, is what Al Gore in his new book is calling the privatization of democracy. In other words, we saw it in the US elections where big business is basically buying the political process out. And obviously it's quite extreme in the US, but nonetheless it's something which is spreading. In your experience of being a politician in politics, are you seeing this trend? Is it a trend that we should be worried about, or is it just something peculiar to the United States?
Well, it seems to me that during the next 100 years, we are going to see an evolution in our political institutions simply because the new elements of the new technologies, internet, Facebook, etc., is going to produce quite a different result. Let me explain just a little. When Gutenberg decided that it was possible to have a press, the press was supposed to be able to print books. Books was important. It took about 200 years to have somebody think that if I have a press, I can have a paper, a newspaper. And the Times emerged in 1700 something. And because you have a newspaper, then everybody knew what are the public problems, quote unquote, for public problems. And somebody, not in England but in France, some philosophers thought that was possible, that if now everybody that is able to read knows what about public problems, well, why the king and his or her advisor are going to solve the issues if all of us here in the room are able to read and we can think something of our own? And democracy, modern democracy, was born. First you have to know how to read, then you have to listen because you have the radio, then you have the TV, you have to see. But during all these years, democracy means that there is a leader that emits ideas on a paper, on the radio, on TV, and every 4 or 5 years you vote. What of these different ideas is better? And this is why democracy is representative, because you elect your own representatives. The question is that today, when I'm talking with you, these very interesting things, in Twitter somebody can put 2, 3, 4, 5, 100 tweets, and Mr. Lagos now is in a different position. He has to listen. What is the thing where now everybody is emitting? There is not only the leader that emits and you vote. Yes, of course. In the previous time, you were able to send a letter to the paper. But that was very unusual, you know? But today is different. So what are going to be the new institutions? What I'm thinking about? Well, if it is possible to have a plebiscite for everything, No, of course not. But something can be done on that. Are we going to be back in Athens? Well, Athens, not today Athens, but Pericles Athens, you know, 2,000 years ago, where every Sunday everybody meet and discuss. And the 100 or 200 citizens in Athens were able to talk to each other. But now, because of the new elements, are we going to be able to think at once? If it is possible to think that if Congress is going to approve a law, a particular number of citizens can say, I don't like this law. Therefore, I ask for a plebiscite to abrogate the law. So, I give you my representation, but the way that all of you are representing all of us, it doesn't fit with the new majorities. What about that? In other words, how much our democracy is going to be representation and how much our democracy is going to be participation? That's one point. Number two, very important, I think. Till what extent in a democracy, really what you are going to define is what kind of public goods are going to be public. In other words, what kind of goods and services should be at least available for everybody. I don't mind if this is given by the private sector, by the public sector, by the market, or by the government, or whatever, but this is the minimum. When you say public education at least 4 years, 6 years, 12 years, what is that? It's a definition made by society, how much education is the minimum that you will need to have. Let me take one example. For me, it's very clear. I was opening a new hospital in Chile, beautiful hospital. Better speech by the president, you know, explaining how important was that new hospital. When, after we cut the ribbon, of course, a gentleman approached me and said, Mr. President, you have to thank me because I was going to interrupt you. What kind of hospital are you opening today? In this hospital, Mr. President, I'm sure that you have no idea, they have no scanner. Well, when you're a president, then you look behind you, there is a minister to answer those difficult questions, and the minister say, Mr. President, you know, the scanner is in the next city, 60 kilometers from here. Therefore, given the number of population living here, it doesn't justify to have a scanner in the hospital because 60 kilometers from here, etc., etc. I said, you see, that's the answer. And the gentleman said, I'm sorry, Mr. President, I want to have a scanner here in this city, period. For them, to have a scanner was a public good. How is it possible not to have a scanner in that hospital? Now, I always say this because how are you going to make this definition? And with regard to the issue of health, that, as was said by the previous speaker about this card, I really like that, when he said that health was the most important issue. I think that health is so important that the question that is left either to the market or to the government is such a serious question that everybody has something to say about that. And therefore, it seems to me that what we will have during the next 100 years is going to be how much participation and how much representation. Who are the ones that are going to make the definition, what are the public goods, and needless to say, or the minimum civilizatorio or Bobbio that I mentioned, because those are very dynamic concepts. As our economy is growing, then what? How much of that growth will represent better health for everybody, for instance? And who will make that definition? So, in short, I think that at the very end, the question of solidarity is another way of looking because this is a definition taken by everybody. And I think that now we are in a position, in a much better position. Why? Because many countries are moving from rather poor countries or developing countries to middle-income countries. And when you have middle-income countries, you have also at the same time middle classes. Like in this country, where they say that you have about 200 or 300 million Chinese as a middle class. Well, let me tell you, it's one thing to defeat poverty, and how much money you need to defeat poverty, and quite a different thing how you're going to face the demands of the middle class, because they'll demand more education for themselves or for their kids. And this is quite a different thing. Final point. The idea that as you increase per capita income, you are going to solve many of the social, economic, and health problems is quite true. Up to a point. After $20,000 per capita income, what is really important with regard to social and health issues is not so much what is your per capita income, 20,000, 30,000, 40,000. What is important is the distribution of that income. And therefore, there is a change in paradigm. When the question was increasing per capita income, and suddenly you discover that social and economic indicators in New Zealand or in Japan are much better than the United States. And the answer is the kind of correlation with distribution of income. And needless to say also, it's much more easy to defeat poverty than to produce changes in distribution of income. And if this is the real issue in Latin America at least, let me tell you, before or after taxes doesn't change nothing per capita income distribution. Quite different from those developed countries when before and after taxes is a tremendous change. In short, I think that these two issues are going to be essential in the next 100 years, or at least in the next 50 years. Thank you.
Thank you. And in the spirit of us not just speaking, but listening, just to say that you will have an opportunity to put your points of view and questions and answers in a few minutes. So please be ready and start to formulate your thoughts and so on. Dr. Agnes, I want to come to you and just put to you that one of the trends that's not on the list, but perhaps should be on the list, is women and increased education, and you were talking about your community work as an empowerment. The recent survey that was done by the OECD suggested that the gender gap in the more developed countries in economic terms between women and men are about 60% reduced, but politically only about 20% reduced. How do you see moving forward the importance of women increasing or not increasing? Do you think that's a trend that should have been brought up or should be more prominent?
There are two ways to view that. I think that if we go for same right for all, gender issues are going to raise. And this will make you think about, if we want to bring the vulnerable, the bottom of your society, benefit of what you are doing, you always think about women, but not about women. I'm a woman, but I'm not vulnerable. You are going to think about the vulnerable woman. That means your definition starts by bringing the bottom on to benefit of the evolution and the welfare of your society. And among them, you'll see that among the vulnerable, the women are the most vulnerable. But it's not a matter to think about women and look at me. So women, for me, gender is not so much an issue. Think about poverty first. And if you talk about Africa and the theme of today, I will say to Africa, be optimistic and dream. Because Africa is a country of hope, whatever we say in the news, etc. And I remember that I vote for education, research, and new technology. And if you see where we come from and where we are today, only in HIV/AIDS, even in maternal mortality, even in child mortality, we have made progress. Not enough because we didn't do the right research and the right way to think about that. So if we think about women, think first about the poor, not the woman per se. And among the poor women, and go with almost minimum 5 principles. You have talked about equity. Equity is key. You should never promote a part of the society. Bring the benefit to all. Women will be included. Think about sustainability. if you promote women today, many projects are pilot in Africa, I guess in India also. And they never go to scale, never go for pilot, go for national. In Rwanda, we used to say we love pilot, but in Rwanda, in the plane. Not in the health sector. So always go for sustainability. So that those women, those poor we bring up, they stay there. And the only way to go is up again, not down. And this is a big problem. Another thing, another principle to choose is evidence-based. Whatever policy you do, don't do it because you feel it. And this is the majority of the problem. Our politicians want to please the population and go for feeling. Sometimes we have to go for hard decisions because those are the ones evidence-based. And the last principle I will going to talk about is what you say, participation. Even today, without waiting tomorrow, never do for people what concerns them without their contribution, their participation. And this goes for education, because what is the contribution of somebody who doesn't know? So educate so that people can participate to their well-being, and well-being go with happiness. You know, do you know that one of the reasons of resistance in the North is lack of happiness of people living with HIV/AIDS? Lack of social capital, lack of social cohesion. Huh? So when I was saying that Facebook can be good, connection, tweet can be good, change a political future of a country, but be careful, study the side effect of that, because it can also break some society and bring some resistance. Well-being is important. Those tools have to serve the well-being and the welfare of people.
Thank you. I think you're being a little bit unfair on yourself. I don't know if you're aware, there was a recent survey which found that ministries which were headed by women had much lower levels of corruption than...
Absolutely. Not only ministries, cities, ministries, everything. Everything. But this is a normal issue, maybe. This is maybe linked with the chromosome X. We don't know. That's why we need research. But it's not that... It's not for that with nanotechnology we will inject the chromosome X to men. No, no, keep men like they are.
Sally, finally to you before I open it up. And I do want you to... we've had a very good conversation so far, but it has been rather, on the upside. And I want you to reflect a little bit on some of the darker sides of some of these trends, and maybe to prioritize the trends in terms of some of the dangers that some of these pose. I mean, science and technology, as you know, has its dark side as well, and the internet as well, in terms of privacy and so forth. So what are some of your fears about some of these trends?
So, can people misuse science? And that started with the debate about nuclear, and dual-use science at the moment must be one of the issues. 40 scientists have just announced that they're going to go back to researching the flu virus and see whether they can make the avian flu virus fly through the air, and we humans will catch it easily. And you do sit back and say, do we really need that research? Is it advancing mankind, or is it advancing a risk? And I'm open to that, but I worry about it. But that undoubtedly we do have risks with science, and we know that there are bioterrorist stockpiles around the world. There are risks from the science in that sort of way. I think we have other risks which come back to societal risks. We know that when we were debating, might we get a flu pandemic, and H1N1 was rattling, there was concern about virus sharing and the rights of virus sharing, and not unreasonably, it goes back to global solidarity and interdependency, nations where it might have arisen saying, why should we share it with the North so that they can be immunized and we don't get anything out of it? And I think that was a very worthwhile debate, because it showed the interdependencies and a resolution was found. So where else do I think we're going to have problems? I think one of the big issues in the future will be water wars. Are we preparing through science to make sure we have enough clean water for our populations? It can take you back to mega cities, it can take you in many ways, but we in Britain are profligate with water. We travel, you go to Spain and they're busy watering golf courses for tourists, and then they have to ship in drinking water into Barcelona. We are going to have water wars if we don't think through the social sciences about water, the sciences of cleaning up water and desalination, and how we're going, and back to solidarity, how we're going to share it. Is that a taster?
Yes, thank you. Well, we've got 15 minutes or so, so it's an opportunity for you all to come, and there's microphones, I think, roving microphones. If you can just put your hand up, and I do urge you that we are in election mode, so you must focus on a trend or trends that you feel are particularly important, or if you want to challenge any of the statements made by the colleagues. So please raise your hand, and we'll try and spot you. Okay, so I have a hand over here, and I think I have two at the front here as well. So where are the microphones? So there's one here, and there's one. So why don't we start with the microphone, and I'll come to you.
Thank you for giving the opportunity. I am Mushtaq Hussain from Bangladesh. The trend that has been written down for us to discuss, and our wise panel members put forward, I have many things to agree with them. But I want to emphasize one thing. If we want to have access for every citizen of the world to medical care or health care, we have to change the system of health care delivery or public health system. Individual capacity improvement, the strategy, I think it will take thousands of years to reach health facilities for every citizen. We have to change the policy of the government and the societal structure so that every citizen can have their health care. But if we try to put money in the pocket of the disadvantaged people, and we hope that they will buy the health care and they will have a health equity, I think it is not practical, and it is avoiding the responsibility of the state to provide health care for every people. My second point is that regarding scientific innovation, the nanotechnology or many sophisticated scientific development will be invented only in the rich countries like United States or Europe, and the people who are living in developing countries like Bangladesh, they will only buy as a client the high technology, and they will improve their health status. I think it is also an impractical thing, and the digital divide will never end. We'll be at the receiving ends as client, and the developed world will take the responsibility of inventing nanotechnology or higher technology. So steps should be taken so that the scientists in the developing world come forward to discover the new technology which suits their country in developing setting, so that they can decrease the gap, scientific innovations, and dream for a quality life. And then we can hope that our digital divide will be reduced to a minimum. Thank you.
Thank you. We'll take a few comments and then come back. I had one over there. Yeah.
My name is Yuan Li Liu. I'm a slave of two masters. My old master is Harvard School of Public Health, and pretty soon I will have a new master that is Peking Union Medical College. My question or comment is on, I thought, is a missing underpinning trend, that is globalization. To me, that's an underlying trend of all the 10 trends we have been discussing so far. So I'd like to ask the panelists to comment on the role of globalization, either as an amplifier or barrier to the 10 trends that is unfolding. And the second, we are celebrating the centennial of a Rockefeller Foundation in Beijing, and rightly so. But so far, China has been on the receiving end of the grants and donations and so on. Looking forward, in the next 100 years, China pretty soon becoming the #1 world economy is inevitably going to play a growing role in giving and contributing in a globalized world. So I also like to ask the panelists to comment on the role of China vis-a-vis the globalization.
Thank you. Yeah.
Thank you. Oops. Anne-Marie Kimball with the Gates Foundation, and I'd like to second the remark about collaboration and the digital divide. And I wonder, I guess when we say technology races ahead, the question I have for Dr. Frank is, you spoke about cooperation and you spoke about solidarity, and I was curious why collaboration could come in there, because what I see is a real need to turn over the new science and the means to the new science to scientists in the South. Because I think when we say science, we have a certain sort of Northern European American construct of science, but in working with scientists in the South, I find that there's a whole new level of imagination and a whole new level of creativity, even in fields we think are dominated, such as informatics, where it's just surprising the constructs that come forward. And so I guess I would appeal to technology races ahead, but wonder how we can really bring in the governance and collaboration and sharing into that equation. Thanks.
Thanks, Henry. You can just pass the microphone along. Did I have someone at the back got a microphone?
Thank you. I'm Rahman, an economist from Bangladesh. I thought the discussions about the democracy and the solidarity, etc., missed one point, is that as the moderator mentioned, this disturbing trend in US about the privatization of democracy. In the political marketplace, the counterattack to that has to be through more efficient delivery of services. And I was struck that no one mentioned the public sector reform as a priority, because that the specifics of delivery and the efficiency of delivery is going to be one of the key health challenges, especially from the point of view of the ordinary citizen. So that I thought was an omission. The other on the mega cities, are we focusing on it only because it's a new space? Or is there a different type of challenge there? I mean, one data from Bangladesh which I find very striking is that in Dhaka city, which is a mega city, the poor's economic opportunities have expanded. Extreme poverty was halved between 2005 and 10. But during the same period, their social indicators actually stagnated. So unlike in the rural areas, in the urban areas, we find the urban poor are being given economic opportunities, but not the social opportunities which they should have. So that sort of a contradiction are the type of challenges we have to solve by our focus on urban areas. Thank you.
Let's just, quick comment if you can, and then we'll go behind you.
One very quick comment. I'm Ajay Mahal from Monash University in Melbourne, Australia. And I have to say I respect you a lot, but I would respect you a lot more if you actually emphasize the demographic revolution. To me, the big nightmare is not anything else. It's the big nightmare is the battle between the young and the old that's coming.
Okay, good. At the back.
Yeah, my question is somewhat related to the gentleman from Bangladesh. Would the panelists care to comment on your view of the role of government in the evolution toward the future that you are dreaming of? And also, what consequence the future is going to have on the government? Or if you wish to be more specific, choose a more specific topic. Equitable healthcare is widely interpreted in many parts of the world as government-run healthcare. Yet the government's ability to run anything effectively and efficiently is highly questionable. So how do you reconcile the role of the government in this journey?
Okay, we'll take one final comment, or question from here. Thank you.
Okay. I'm Joan Kaufman. I'm the director of the Columbia University Global Center for East Asia, based here in Beijing. I had a couple of small points. One issue, I think, is the issue of sort of global stewardship and governance that Dr. Frank has written so much about, actually, and I've learned a lot from. But really looking at the global institutions, especially the global trade institutions, the market institutions, and the health institutions, I think without some real traction in coordinating things like the global agricultural business and other aspects of sort of the global trade system, we're not really going to get very far in controlling things like the global obesity epidemic, the pollution of water, the use of water resources, and things like that. So I think we really have to think about the larger, sectors and the privatization of certain sectors and the market forces that are driving a lot of the health problems around the world, and put that on our map as part of the solidarity and stewardship agenda. The second one is looking at the intersection between some of the 10 issues, because I think you can't talk about, for example, megacities without talking about climate change and looking at, where are these cities located, often in low-lying coastal areas, some of the biggest cities in the world, Shanghai and other places. Climate change is going to create a set of challenges for these cities, in addition to the demographic challenges of, the aging populations, the non-communicable disease burden that's going to bring, and the pressure on social security system. So I think we have to really look at the space between the 10 issues, the intersection of the issues, and not carve them out as individual, areas. So those are my 2 points.
Okay, we have only got about 4 or 5 minutes left, so let's do a quick summary and sum up, and maybe I'll start with Mr. President. Maybe a couple of the questions related to your point about expectations of the middle classes in particular and the reality of being able to deliver, so whether it's in terms of public sector capacity and reform to deliver versus the private sector and governance. Any further comments on this real governance gap, if you like, between expectations versus ability to deliver?
Well, probably the most difficult part is how you're going to administer expectations, until what extent you can offer some dreams that you can deliver. That's the real issue. And in the case of the emerging middle classes, I think, it's a tremendous challenge in order to fulfill those things. And I like very much to address the issue of globalization that was presented by 2 or 3 of you, because globalization also, some dreams became globalized. In other words, people like to be like other people, and this is part of the globalized process. And sometimes, you are globalized in what about consumers would like to consume, but you are not globalized. What about the productivity that you have to produce those items that people would like to consume? In short, globalization is here to stay. And that means that more and more issues cannot be solved by any particular country in the world, no matter how important is that country. Climate change is a very good case for that. All of us know that without the US and China, which are responsible for 40% of total emissions, both two countries, it's impossible to solve the issue. But at the same time, all of us know that with regard to the rest of the countries, it's also the two alone are not going to solve the issue. So what kind of dialogue and where that dialogue is going to take place is probably the major point. Number 2, if many of those issues that used to be considered domestic policy issues are becoming global issues. Example, migration. In many countries, migration is a domestic policy issue. It's the best issue that you are going to have in Europe today. What about the relationship between migration from Islamist countries to Europe? Or what about migration from the south of the United States to the United States? Until what extent is possible to believe in a globalized world where everything is globalized with the only exception of the human being? And migration of the human being has been the most essential part of we human beings since we are in the planet. As Carlos Fuentes used to say with regard to Latin America, in Latin America, all of us are migrants. Some migrants arrived to Latin America about 30,000 years ago from Asia or Africa, and some others arrived from Spain 500 years ago, and others during those days, nobody asked for a passport and a visa, but migration is one. What about drug trafficking? Drug trafficking and drugs is an internal policy issue or is it a global issue? As far as I know, most of the tunnels under the frontier between Mexico and United States are discovered in the Mexican side. So who is responsible for the drug issue between those two countries? Until what extent this is not a domestic policy issue anymore? And what about pandemias? And pandemias used to be global in a much more globalized world than used to be in the past. In other words, and not to mention anything about peace and security and things like that, that by definition are global. But the question is, how are we going to have be living in a globalized world if we don't have some rules? And who is going to put that rules in that globalized world?
Thank you. Prof.
Very interesting comments, but we're out of time. So I would issue my final vote for what Anya said at the beginning. I think the last 3 of the 10 trends have one commonality, and I think they underlie all the others. I believe what we need to really invest in is knowledge. Because when we look back to the 20th century, the health revolution of the 20th century, the health revolution that brought a doubling of life expectancy, was mostly fueled by advances in knowledge, which improves health through 3 mechanisms. One, it gets translated into technologies. That's the one we know better drugs, vaccines, etc. But knowledge is also internalized by people who are then empowered by knowledge to lead healthier lives and shape their environment in a healthy direction. And third, knowledge translated into evidence becomes the driver of enlightened policy. So knowledge, whether it's in the form of research or, as I was arguing at the beginning, catalyzing this revolution that's being born today, the revolution of new forms of learning through the convergence of advances in cognitive psychology and the technological platforms that allow us to think of massive open online courses. I think that idea of both the production of new knowledge and the reproduction that we can do through a global learning experience, I think this is what's going to catalyze the next phase of the health revolution into the 21st century. And it will reflect something that several of you said. Knowledge is the ultimate global public good. It's the glue for enlightened globalization. Globalization can also lead us into the way of exclusion, of growing fragmentation. That's the path of discrimination and xenophobia, etc. We need to find the way towards enlightened globalization that assumes interdependence as something positive. And the way we're going to do that is to realize we now live in a multipolar world. There was the question about China's emerging role, and we are truly in a multipolar world. We're changing the paradigm from the old paradigm of global health, where problems flowed from south to north and solutions flowed from north to south, to a new paradigm where actually a lot of problems actually flow from north to south. Witness the tobacco industry and other such global public bads. And solutions are increasingly flowing from south to north. And it's only if we really develop the governance mechanisms to make sure that we produce the necessary knowledge to fuel the next phase of the health revolution that I think we will achieve that kind of enlightened globalization that I think is what we need for the next 100 years.
Thank you. Very persuasive there. Sally.
So clearly I support what you've just said, and what we haven't mentioned is the rise in negativism about science or science denial. Creationism has even crossed to the United Kingdom, I'm sad to say. So as we talk this through, we do need to work through how are we going to harness knowledge so that it cannot be denied, and that will be very important. I like your issue about changing paradigms, and I think we're at a tipping point that a number of you have brought up, of shifting from debating how we give healthcare to everyone to how we change to a health model about prevention, self-management, dignity. And I think it's in the air, but we haven't quite crystallized that paradigm shift that if we really want to move forward, we're going to have to do. And I want to just finish on saying, you know, we might never get to, I'm overemphasizing, mega cities. We might never see climate change if we don't globally face the problem of antimicrobial resistance. Right. We are down to one drug for gonorrhea, and I can tell you, in Britain, gonorrhea is going up in young women and young men and middle-aged women. And we've only got one drug. And yet we have a broken market model. So science is terribly important, because otherwise we're not going to see climate change.
Thank you. Final word.
So the comments were great. And I like one on the role of government. The role of government is to change for the better the life of each and every citizen, meaning citizen-centered. And for this, we need the participation, and we need accountability to who? To the citizen through parliament or other system the country put in place. And the participation of the citizen is a key for that. And this goes with the dignity and what the other panelists have said. The second comment was public reform is not in our mind. It is. Everybody told you vote for what. But I say the three I propose you are, all the others are underlined, and they have said that you cannot do that without public reform, but even more than that, global reform. How are you going to regulate the global warming when the countries that are suffering the most are not responsible, are vulnerable in front of that? Also, you have part of the world that are dying with lack of nutrition, malnutrition, when there is other part of the world where you throw food in the dustbin. You don't think that this needs a global regulation or a global solidarity approach? The third one was for epidemiology, there are new problems. Some of the new problems are just the sign of the success of the previous politic and strategies. Now, in my country, if we face more cancer, it's because 70% of reduction of death by infectious disease. And we see that globally, we have to be ready to face a new, and that's why we need a science. The other one was the sharing of research. This is also need global regulation, because there are some scandals there. There are countries in the developing world that contribute to the development of vaccine with the body of their citizens, and their children have no access to vaccine. This is a new way to slave people. This is a scandal. So also, when you do research in the developing world, always associate and transfer capacity to the researcher there, and make them part and own part of it. So another thing to do for Rockefeller Foundation, Gates Foundation, all those people who know what money is, promote reverse technology. Give money to the researcher in the third world. Give them a prototype. They will turn it in something cheap and accessible. And India is an example of that. But we could all participate for the good of humanity. So this will answer that question. And the last thing is globalization, for me, it's not a threat. It's an opportunity. If globalization means my people have the same basic care access than the best country, go for it. And just mitigate the things that are pulling some country down. But always, never forget who you are, never forget your culture, always think that your problem is a local problem and not the same. I don't have the same problem than in England, so I need to be able to develop homegrown solutions. But globalization is an opportunity. Thank you.